Good morning. It is today, Saturday, June 3rd, and Dad and I are going to a remote area medical clinic today in Chattanooga. And this is very exciting because it's the first one we've ever been to. And basically what a remote area medical clinic is, it's a lot of volunteers and doctors come for free to help people that are underinsured and don't have access to healthcare in remote areas to have free healthcare. And so here's Dad. He forgot his stethoscope. But we're going to the clinic right now. We woke up at 4 and it starts at 5:15 and we're planning on staying until around 9 or 9:30. All right, let's go.
Good morning. We're here for volunteering.
Follow that green truck to the back parking lot.
Okay.
Thanks for volunteering.
Thank you. So this is the room for general medicine, and it has like 2 chairs and what is this called?
Stretcher.
A stretcher, so that the patient can come and they can talk to each other and all that stuff. I got my general support badge. Hopefully I'll be helping out with, guiding patients inside and not registering, because I kind of want to be in the middle of everything. But we just walked in and we saw everything. There's like an entire lower lobby of dental hygiene stuff. So like all of these seats and dental equipment, and then the upstairs is like general medicine. So it's like split up really well.
Your demographics, and then you'll fill out all of the lightly shaded gray areas. On all. And then I think to know about traffic is we are sending dental patients down to the end of the hallway.
So I'm back from the remote area medical clinic from this morning. Actually, we got back at around 10 because we made a bunch of friends. They were actually the USPHS, which was the United States Public Health Service. A lot of their people came through a bus from all over the country to help with this clinic today. And so we made a lot of friends from there. Everyone was working from like DC, the CDC. A lot of cool people were there to help today. And I got home and I ate and then I went to sleep for like 3 hours. So now I'm awake and I'm going to give like a rundown of exactly what went on. So basically the setup. So when you walk in, you go through this thing called triage. And so basically what that is the patients coming in, registering, talking to a bunch of nurses who take their vitals and ask for their background medical history and give them pieces of paper that direct them to the next spot. And so there were 3 types of healthcare that were provided. One is dental, one is vision, and the other is general medicine. And so each one had a colored slip that coordinated towards each type of healthcare. And so the blue slip was for vision, the pink slip was for dental, and the white slip is for general medicine. And so you can have either vision or dental with healthcare. So everyone can have general medicine, with general medicine, but you can't have vision and dental at the same time. So they can come at another day in the clinic, which these clinics run for 2 days, and we only went to volunteer today, but it's also happening tomorrow. So if someone came for general medicine and dental today, they could come for vision tomorrow, or vice versa. Today, health or general medicine and dental, they can come for vision tomorrow. I think I already said that. The other one. Anyway, and so after triage, after the nurses talk to all of the patients that come in and take their medical history and give them slips for all of these types of treatment they want to have today, they first go to dental. And so dental was set up really nicely. It had this in the gymnasium of the school, the entire thing was filled with a bunch of like the stretchers and all of these people that were helping pull out teeth. So like there were 2 lines of stretchers in the hall. And so one of them was for extractions. And so if someone actually had like an infected tooth or something that they needed to pull out, that was handled in the extractions. And then the other line was just basic dental hygiene stuff like cleaning and whatever is all encompassing in dental hygiene. And then after that, they can go upstairs for general medicine. And so upstairs had vision and general medicine. So a little bit on vision, which is like separate from dental, of course, you can only have one or the other. But vision, they actually had a bunch of, I think, optometrists and ophthalmologists. I didn't really get to see it that much, but they had glasses everywhere, like just pairs and pairs of glasses on tables everywhere, lined up, and patients would come upstairs and, you know, get their eyes checked, everything that you would do at an eye doctor, and they would make the lenses and the glasses right then and there for all the patients. It was the coolest thing. Like in the back, they were just creating lenses. I didn't get to see that process exactly, but someone told me about it and showed me where all the glasses were, so that was cool. And after vision, general medicine was also really interesting. That had mental health, pharmacy, like booths for women's health, and also booths for just general medicine. So like any kind of internal medicines or just nurse practitioners, and all the physicians were over there just talking to people, if they had like, you know, just general things like diabetes, TB, any kind of thing that they had, that's what was treated at general medicine. And the pharmacy it was cool, the pharmacy had a lot of drugs for free, and not so many where you can, you know, treat anything, but they did have their fair share of antibiotics, painkillers, and the entire $4 list at Walmart. And also Publix did a partnership with them, the RAM Medical Clinic, where they gave certain types of medicines for free, like free refills, free 90-day pickup, everything like that, like free. So that was really nice to see. But yeah, and we stayed there for only, 5 to 9, so only 4 hours, 9:30, so 4.5 hours, and made a lot of cool friends, found a lot of opportunities, you know, to work with medical clinics all across America and things like that, and it's very exciting. It was very humbling to see all of these people and know that they had been standing in line from yesterday to get free medical, you know, attention and, you know, get themselves checked out, which is really important. And so I hope to be able to continue doing these things. I know Dad had a lot of fun. He actually had to go to work right after, so, but I got some sleep afterwards, but it was totally worth it. Very cool experience. And I wasn't allowed to video during it, so I only got some stuff pre-patient coming in thing, so all of the footage that I've shown is allowed and just from setup. But it was very cool. Like, the entire experience was awesome, and I 10 out of 10 recommend anyone that's interested in medicine or trying to figure out if they want to pursue anything in that field. It's just an interesting thing to see everything so different. It's not like regular healthcare where you see, you know, the normal kinds of things that come to you. These are people that have been waiting for healthcare for a long time and haven't had it, so you see a bunch of weird, bizarre stuff, and also just you understand, like, the importance of what you're doing. And so great opportunity, and it was really fun, and the people there are great. Everyone is super nice, and so very good experience. So yeah, that was the first RAM clinic that I've gone to, and it was awesome. Very excited for the next one.